Hi everyone. Now we would like to discuss about the exercise consideration for cancer patient. And as the learning objective today is to give information regarding points that should be considered when doing exercise for cancer patient. Everyone, if we found cancer patient, of course, they are not in the same situation or it's not the same phase. Maybe some of them is before treatment, not haven't treatment yet, or maybe some of them during treatment phase, or some of them in after treatment phase. And three phase before treatment, during treatment, and after treatment for cancer patient will give different of physical fitness because as we know that cancer can be involved our body system, such as like physical fitness, and then because of the angiogenesis or because of cell proliferation, it can be cause several intensity of pain, and also about the because of patient with cancer sometimes limitation in movement, they will get the muscle weakness. So it will be give different of physical fitness among these three of phases from the cancer patient. So because they have different of physical fitness, so when we suggest them to do some exercise or start exercise, we should be considered this uh, type of phases, and also we have to measure their physical fitness before they start the exercise. Scientific evidence have found that people living with cancer and beyond cancer lack of regular. So when before they get cancer from previous studies, someone lack of regular physical activity or low physical activity will have a higher uh, chance to get a risk for cancer. And when after they got a cancer and living with cancer, they also can lack of regular physical activity because of the pain they got, and also because of depression and anxiety um, influence their daily behavior. So they lazy to do some activities, even just at home. They just maybe sitting in front of the window or just lie down on the bed and etc. And multiple studies have documented a lack of recommendation from an oncology clinician. So not only one healthcare provider agree with this statement, but also oncology clinician with their multiple studies found that people with cancer is lack of regular physical activity. And the scientific evidence-based support exercise in patients and clinicians generally agree that patients should be moving throughout their cancer therapy and survivorship. They have to spirit, they have to move from their desire, from their disease, from their experience, and they have to do some activity to make their quality of life better. So when we start prescribe or when we suggest them to start exercise, we have to make a planning about what they can do, how many times, or what kind of physical activity that we suggest to them. The exercise plan will depend on the type of cancer you have. So anyone, when they coping with their cancer, they will know about what they have to do, what they should do, what they need to do. So if we know the type of cancer we have, or we know the type of cancer of our patients have, we can choose a better type of activity or exercise, the suitable one for them to do. And the second one, the plan will depend on the treatment being used: surgical, chemotherapy, radiotherapy, or touchy, it can be. Or maybe they just do herbal because a patient with a terminal stadium, sometimes they don't want to get any medicine therapy. They use a herbal or traditional therapy. But yes, that's their choice. But we have to suggest them, of course, to do another alternative treatment, non-pharmacological therapy, such as physical activity. And the side effect you are experiencing, we should ask them after they get chemotherapy, after they get radiotherapy, after they got surgical, they do mastectomy, what side effect they have. So we need to ask them about this because maybe they have pain. Pain we can make score with visual analog score or number analog score. We can uh, try to interpret the pain. Maybe they got just light or maybe heavy or maybe just moderate pain or maybe they don't have spirit motivate to life or they have a split sleep problem or they have experience with nausea, vomiting, loss of appetite, and etc. It can be the side effects of the cancer therapy, especially chemotherapy or radiotherapy. And then we should know about their level of fitness. So uh, these cancer patients, we teach them about how to measure or how to determine the level of fitness. And with this knowledge, they can determine themselves which intensity they can do or type of uh, exercise they need to do. Any other health problems you might have, maybe not just only cancer, but patient can have also hypoglycemia or obesity or maybe osteopenia and etc. It could be some problem that can they got with cancer. So these five questions we can give to patient, we can teach to patients. In order with these questions, they can coping with themselves. They coping about the cancer that they have and they know now what experience they have now and how to remove or how to solve this uncomfortable experience because if they can move from this situation they can do treatment optimal, they can have a motivate to finish the treatment, to finish the chemotherapy cycles, and they can move on from their life. That's we need to teach and to ask and explain to the patient In other, they can make planning for their own exercise. General physical activity recommendation for cancer survivors. The American Cancer Society has a nutrition and physical activity guideline for cancer survivors, which is cancer survivors need to avoid inactivity. So they need to active. They need to move on from their situation now. They need to active and need to return to normal daily activities as soon as possible after diagnosis and treatment. Because if they come back to normal daily activities, the hormone, which is a positive hormone, will balance the homeostasis in the body and also immune system, and it can make their life meaningful. So if the immune system enhance, they can avoid, or they can or they can prevent themselves from the cancer recurrences. So the life expectancies or the quality of life better than before. And the cancer survivors need to take part in regular physical activity, of course. If they not active, it will be difficult for themselves to throw out, or move on from this situation. And we have discussed about the impact of the regular physical activity, so many benefits they can get. And the important one, after they finish the treatment and they go back to their normal daily activities, what the target is the endorphin hormone. The endorphin hormone will release, so they will relax. The blood pressure will be normal, and also blood glucose level, and also metabolic function. It's very good for the cancer survivor to get this. Start slowly their physical activity and build up the amount of physical activity over time. You need to start slow, go slow. It depends on your physical fitness for the first time. If you have lower physical fitness, you need to start your exercise with the low intensity. But then, slow but sure, you increase the intensity or the time when you do exercise. So the target intensity that recommended from a CMS or other organization will reach day by day. Build up to 150 to 30 minutes of moderate intensity at each week. So you need to prepare or planning for exercise 3 times a week or 5 times a week, 150 to 300 minutes of moderate activity, or 75 to 150 minutes for vigorous activity. If you can do activity for 30 minutes, 20 minutes per session, or 30 minutes per session, or 60 minutes per session, no problem. You can do at least 10 minutes at a time. But consistent. That's important one. Consistent to do. Even though just 10 minutes at time, but you consistent, you will get the same effect also. Include resistance training, exercise at least 2 days per week. Can do with weight lifting, or maybe another resistance training you can do just with your body as the body weight. Oh, no, body weight. Your body as the load. So you can do like push up or wall sit, or you can do just like squat or plank, you can do it. Do stretching exercise at least 2 days each week. So yoga or Tai Chi, you can modify. So what we got from here, what the American Cancer Society recommendation for the cancer survivor. When you got cancer, uh, the physical fitness, cardiorespiratory fitness also influence, and also other body systems, also like muscle, like bone, gastrointestinal, and others, and also your emotion, behavioral, and etc. And what their recommendation is, do aerobic exercise to improve the physical activity. No, to improve the physical fitness or cardiorespiratory function. But don't forget also your muscle strengthening, your bone with the resistance training, and don't forget about your flexibility. Because when you suffering from cancer, you lie down much time, or your leisure time is higher than your active time during cancer. It can make your muscle weakness and your joint not stimulate, so your flexibility will become worse, and it will promote, or it can will lead your risk fall higher than before. So with the stretching exercise, it can improve your flexibility, so the risk of fall risk for the cancer survivors, patients, or cancer with the older adult patient can be improved. No, I mean the risk fall can be reduced. It improves the flexibility. What oncology clinician can do to their cancer patient? What they can do is assess, advise, and refer. So, assess what they're assessing. First assessment, patient physical activity at regular intervals. Assessing this physical activity, because physical activity during medical visit, the function is the same, just like a vital sign, just like the blood pressure. It is just like an alarm to the patient. Oh, you need to know to do this. If you not do this, you can get lower blood pressure, just like that. So blood pressure must be normal, not getting low. Yeah, so it have to be maintenance. That physical activity during medical visit should be asked, because it can prove, or it can improve the patient vital sign, heart rate, also blood pressure, also the another like body weight, yeah, body mass index. It can be maintained by the physical activity. And step two, advice. What the clinician should be advised. Clinician can advise patient to increase physical activity if they are not currently reaching recommended activity level. It's what I said before, that when you try to assess your patient physical activity, you need to know their physical fitness and what are the target or goal. So after the target or goal, when they you see that not not reach the target, or not goal the target, so, or maybe you see that the physical fitness is lower or worse, you can ask them or advise your patient to increase their physical activity. And if you have recommend, you give the recommendation how the physical activity should be reached for the patients, and the patient not currently reaching the recommendation, you can refer the patient to the other professional to help them reach the physical fitness. And so we do the step 3, refer. The patient need referral to appropriate exercise programming based on their current activity levels, medical status, and preference. So the preference here, we also ask them is if them whether they have their own professional healthcare, or they have their own personal trainer, or what about their family. Yes, we need to get the preference also, not only the medical status, but also the preference. And regular evaluation of activity level is needed. And referral to exercise programming could be valuable. Referral to appropriate and effective programs and follow up with an assessment of progress. So after we refer them to exercise programming or to personal trainer, or we refer them to the supervisor, we need to follow up the assessment of progress. Is the program effective or no? This is the Oncology Clinician's Guide to Referring Patients to Exercise. So step 1, assess. As we mentioned before, maybe the question is, how many days during past week have you performed physical activity where your heart beats faster and your breathing is harder than normal for 30 minutes or more? So these questions just to make sure maybe what intensity they have reached. So perform the physical activity where your heart beat faster on your breathing is harder than normal for 30 minutes or more. It's uh, it's a kind of reflected from physical activity that they do is higher the resting level of heart rate. And the question 2, how many days during the past week have you performed physical activity to increase muscle strength, such as lifting weight? Yeah, so it is a question also trying to know about the few physical activity that can be increase the muscle strength. And the question number 3, would this patient be safe exercising without medical supervision like walking, hiking, cycling, weightlifting? And if the answer is yes, patient can be ambulatory. Patient is ambulatory, and then we can do advise them with moderate intensity aerobic exercise for 30 minutes 3 times a week, and do resistant exercise twice weekly 20 to 30 minutes. And step 3, if they have the opportunities and also preference for the exercise, the best to them, we can refer them to the community program. But if the question is no, it means that patient not safe exercise without medical supervision. It means that the patient has another complication present. I'm not sure and I don't have the capacity to evaluate. Then the step 2, you do advise the patient to follow up with outpatient rehabilitation healthcare professional for further evaluation. And then you refer the outpatient rehabilitation healthcare profession will recommend it best available program. So in here, we in care coordination, there is two kind of training program for referral patient with cancer. First, healthcare provider supervised exercise program, which is when the patient in question number 3, they say no, they cannot do exercise without supervision, so they need to refer to healthcare provider supervised exercise program. But when the patient can do exercise without supervision, they can refer out to community exercise program. And in this situation, which both healthcare supervised providers supervised exercise program like cancer rehabilitation or community exercise program, also there is a supervised from the personal trainer or self-directed. It has it need communicate. It has it should be make communication between these two kind of setting. It's very crucial to see the opportunities for distance-based intervention across all settings. So the target exercise in healthcare provider supervised, the target in the exercise intend to address specific clinical outcomes and supervised or unsupervised exercise program in healthcare provide setting for in outpatient rehabilitation. And in this program, the healthcare providers could be physiatrists, physical therapists, clinical exercise physiologists, occupational therapists, and nurses. And community exercise program supervised or self-directed exercise can be setting. For supervised can be setting in primary care or community or fitness center or home with the healthcare providers is are exercise physiologists, nurses, fitness professional, and peer coaches. And for setting the community exercise program that do self-directed, the setting is in community or fitness center or home that the practitioners is fitness professionals. This is the example cases for assess, advise, and refer. Patient one is a 75 years old man with metastatic prostate cancer who has been receiving a hormonal therapy for 12 months. He has controlled hypertension, a body mass index in the obese range, and has a history of non-insulin dependent diabetes. He underwent a hip replacement 3 years ago. He still aims. In answer of the first two questions, he reported being completely sedentary. His Eastern Cooperative Oncology Group performed status is 2, and the clinician would refer him to an outpatient rehabilitation clinician. And the example of patient number 2, a 39 years old woman with stage 3 colon cancer who completed surgery 8 weeks ago, entering a 6-month course of chemotherapy. Her body mass index is the obese range, but she has no other chronic condition. In answer to the first two questions, she reported walking at lunch once or twice a week. Her Eastern Cooperative Oncology Group performance status is 0. The clinician can use the moving through cancer exercise referral form to recommend increased exercise to 30 minutes or aerobic exercise 3 times a week and resistance training 2 or 3 times a week. If there is a local exercise oncology program known to the clinician, the patient can be referred directly here. So this is the form for oncologists or primary healthcare uh, to assess the cancer patient and to make a planning for moving through cancer. So they need to put the name and the date for the first suggestion. And this is a form for aerobic activity and this one for muscle training. This is it's very important to as evaluation is our evaluation. Just like aerobic activity, we can choose here for the first time which intensity that we recommended, and after monitor evaluation, we can choose another intensity for based on our evaluation, and we put the time and type of the exercise, and this is for walking steps per day, how many steps per day. They need to make checklists day by day to their diary, so we can make evaluation and the progress of the exercise planning. What about the aerobic activity, moderate activity at a pace where you can talk but cannot sing? Yeah, we tell them about how to measure the intensity in aerobic capacity activity. A moderate activity when you can talk or but not can sing. Just example like brisk walking, light biking, water resistant, and dancing. And vigorous activity where you have trouble talking and may not be out of breath, like jogging, tennis, and fast bicycling. While the recommendation is build up to 30 minutes per day, at least 3 days a week, we can exercise for any length of time. For example, you might walk 5 minutes here, 10 minutes there, and 15 minutes daily. Just work your way up to 30 minutes 3 days per week and gradually build up to a daily step count of 7,000 to 9,000 steps per day. And this is the muscle strengthening training. What about the strength training? You don't have to go to a gym. You can use elastic bands, do body weight exercise like kitchen counter push up, chair sit to stand, or lift dumbbells. Have you walked around your home? Also build your strength. Stretch your leg, stretch your back, stretch your chest and arms. To start, try 10 to 15 repetitions using light effort. Build up to medium or hard effort for 8 to 12 repetitions. Repeat 2 to 4 times, 2 until 3 days per week, and give yourself a rest day between each strength training session. And you suggest to write down what your specific goals or specific risks or specific instruction or local programming that give it to you. So the component of an exercise session for cancer patient, it start with warming up phase regarding mode of exercise. Exercise session should start with 5 to 10 minutes low intensity, incorporating light stretching exercise, and then continue with aerobic exercise for 4 to 7 times per week, 30 to 60 minutes of walking, cycling, or rowing. And then your do resistance exercise should target major functional muscle of the upper or lower limbs and trunk. 6 to 9 different exercise and flexibility exercise 3 to 4 times per week, 2 to 4 sets per muscle group, 15 to seconds, 30 seconds stretching time. Upper, lower, and trunk flexibility exercise, and then you can finish with cool down phase such as like slow walking or light stretching. So these are our conclusion. Patients with cancer need to give physical activity to increase their quality of life, reduce pain, and to support cancer treatment improvement. Before clinicians suggest patients to start exercise, they need to consider the type of cancer for patient, kind of treatment, side effect that rise after treatment, physical fitness, movement ability, and comorbidities. Clinical oncologists need to evaluate the patient abilities and adherences to do exercise before they think to refer the patient. Okay, thank you very much. Let's move on. Move your body and stay away from the cancer. Thank you very much. Goodbye.